Bismillahirrahmanirrahim. Assalamualaikum. Today we're going to continue our topic lecture for hazard identification. These slides will identify or we'll talk about toxicity and toxicology, where we're going to go for a Probit analysis and also how to determine the probability which relates to the percentage of damage. Alright, toxic, before we go into the calculation part, we'll go through fast on the sort of understanding on what is toxicology or toxicity. As you all know, toxic is a substance of poison, and the right dose differentiate between a poison and a non-poison. Okay, and the word toxicant represent the word toxicant is a chemicals. Remember, toxicant is chemical, physicals, or biological agent. Those are the three definitions, keywords for to define a toxicant that may have an adverse effect on biological organism. So there are very important keywords to describe what is toxicant. Toxicology is a qualitative or quantitative study on the adverse effect, is the measurement part on a biological organism. That's we call toxicology. Toxicity is a property of the agent. Property of the agent describing the effect. How high it is toxicity, how low it is toxicity. And lastly, industrial hygiene, which is a technique to reduce toxic hazard of substance. So these are all the terminology which you need to understand the differences between these four terminologies. Chemical toxicants includes inorganic substances. Example, lead, mercury, asbestos, hydrofluoric acid, chlorine, or other organic compounds. Alcohol or most medicines. These are all chemical toxicants. Or biological toxicant includes bacteria, viruses that are able to induce disease in living organism. Physical toxicant, which includes, for example, fiber, direct blows, concussion, sound and vibration, heat and cold. So these are three types of toxicant, which includes chemicals, biologicals, and physical toxicant. The main thing that you want to know, the way toxicant enter the biological organism, or the way toxicant are eliminated from the organism, or the effect of the toxicant on the biological organism itself. So these three are called toxicology. And the methods to reduce this, we call it as a industrial hygiene, right? So the method or to prevent, to reduce the entry of toxicant into the biological organism, we call it industrial hygiene. There are four main routes of how toxicant enter your biological organism. The first one through ingestion, which is through your mouth and through your stomach. For example, eating, drinking, and smoking. Second one is inhalation, through your mouth or nose into the lung, ventilation, respiration. The third one is injection, through cuts into the skins. And the last one is dermal absorption through skin membrane. So this, how to control this is, for example, ingestion. You have rules on eating or drinking, smoking. Inhalation, you have to prevent from inhalation of toxicant. You have ventilation, you have respirators, food, and other personal protection. And to prevent injection, through cuts in the skin or proper protective clothing. Dermal absorption, you have a proper protective clothing. These are all the control methods to determine or to avoid the risk of ingestion, inhalation, injection, and dermal absorption for a toxicant. Or between these four, injection, inhalation, and ingestion, and the most severe routes or the most effective, where easily through injection it can, the toxicant can enter the blood. So through injection, the toxicant can easily absorb to your body system through your blood. Second, followed by inhalation and ingestion, and also dermal. And also when it comes, when if the toxicant can go in, it can also goes out. So how this the toxicant can be eliminated from your body is through excretion. For example, kidney, lung, liver, and other organs. Or you detoxify it by changing the chemical into something else. Or lastly, by storage into the fat tissue. So these are the main three how this the toxicant being eliminated from your body. And this is the root elimination. For example, when you digest it, it goes to the liver, to the kidney, and lastly you eliminate. And also it goes to the blood and will go to the target organ. These are the flow or the routes of the toxicant. So what are the effects of the toxicant? The effects which are irreversible. This is very dangerous, which is carcinogen, which can cause cancer, mutagen, can cause chromosome damage, reproductive hazard, can cause damage to the reproductive system, and also teratogen, which can cause birth defect. And also defect that may or may not be reversible. Dermatoxic to the skin, to the blood, to the liver, to the kidney, to the nerve system, and also to the lung. These are all may or may not be reversible. We need to do some toxicological studies in order to help to reduce the risk of this toxic exposure. So the main objective is to quantify the effect of the suspect toxicant on a target organism. When we can quantify, so we can design or we can prevent the toxicology or the toxicant enter your body. Animals also be used. How is the study being done? We use animals, rats, rabbits. So before a study, the following item must be identified, which is of course what are the toxicant that we need to study. What are the target organism? For example, the lung or the kidney. The effect or response to be monitored. What are the responses that you want to jot down? For example, the heartbeat or the death. Next, the dose range. The variables which is you might be testing at different dose. And also the period of testing, how long you want to monitor the study. So these are the main items that need to be identified before a toxicological study being conducted. The dose unit depends on the method of delivery. For example, normally it being done for substance delivered directly or ingestion. The dose is measured by milligram of agent per kilogram of body weight. It depends on our body weight because higher body weight might need a higher dose and vice versa. For gaseous airborne substances, the dose is measured in ppm, parts per million, or milligram of agent per cubic meter. So these are all the units of measurement for the dosage of a toxicant. The time or the period of the test depend on whether the long or short-term effect are interest. For example, we call it an acute toxicity. Is defined as an effect of a single exposure or a series of exposure close together in a short period of time. We call it acute toxicity. While chronic toxicity is the effect of multiple exposure occurring over a long period of time. So to differentiate this is the word acute. Acute means a short period of time. So chronic toxicity studies are difficult because the most toxicological study are based on acute exposure, because we in toxicology study normally we don't do it too long. So we measure it at the acute level. Biological organisms respond differently depending on their age, sex, weight, diet, general health, or other factors. So these are the factors that can lead to a different response towards your dosage or toxicology studies. With an example of experiment with the rabbits. For example, we have 50 rabbits. We are using 50 rabbits, and these rabbits are exposed to a fixed concentration of a toxicant. Then we measure the variety of responses. From that responses, we table out in a table. The data is tabulated in this table. So 1, 2, 3, 4, 5 is the scale of the response, which is the 1 is the least response and 5 is the worst response for the rabbits. And we can see here the lowest response from the out of 50, the worst, only one rabbit responded worse from the toxicology studies. And the highest response comes at the number 3, which is medium response. So from that, we can see an average of 2.98 response. So average, so out of 50, average response is at number 3. So this is how we determine the response curve. Then we tabulate response number 1, 2, 3, 4, and 5. So we have an average over here. And previous one was the first dosage, so you get an average response of a 2.98. You might be interested to increase the dosage to D2 and to determine what are the average response, and so on. You keep on increasing the dosage. So you can expect this will go higher. The response, the average will go higher. As you see, when you increase the dosage, the average response will increasing throughout increasing the dosage. What is little dose curve? Little means death. So if the response of interest is death or lethality, the response versus lot dose curve is called a little dose. Means the dose that can go for lethality. The dose that results in 50% lethality of the subject is frequently reported. So this is called LD50, which is 50% of the population of the subject is dead. Or other values such as LD10, 10%, or LD90, 90% are sometimes also being used. For gases, we call it as a lethal concentration, which is what are the dosage of the toxicant, whether it's a gas or a liquid, that can lead to death. So this is an example, various type of response dose curve. Toxic response, we call it an effective dose if it is a medicine, a toxic dose, and also a lethal dose. There are models for dose and response curve, but I'm not going to explain you the explanation on this mathematical equation. But the main thing is you can develop the Probit variables, which is called Y, related to the probability P. Or we can simplify by using this curve, probability versus percentage. If you have the probability, you can calculate how much of the percentage of the probits is going to happen. Okay, I'll stop by for a while. Then next section or part 2, we're going to continue on how to read this table transformation from percentage to probits.